Welcome to Grossmont Union High School District's COVID-19 Infection Prevention Training. This training satisfies the California Department of Public Health and the California Occupational Safety and Health Administration requirements for all employees, students, parents, and other parties. So what is COVID-19? You may have heard other names such as COVID, Rona, coronavirus, or novel coronavirus. COVID-19 stands for Corona Virus Disease 2019. This strain is new to the world. Novel is Latin and means new. There are many different types of coronaviruses. For example, SARS-CoV, Severe Acute Respiratory Syndrome coronavirus, and MERS-CoV, Middle East Respiratory Syndrome coronavirus. COVID-19 is the disease which is caused by the virus SARS-CoV-2. There is currently no vaccine for COVID-19, and the virus has spread across the entire world, leaving no country untouched by its devastating impact on us. To view California's current COVID-19 statistics and the San Diego County current COVID-19 statistics, please visit covid19.ca.gov. How do you know if you have the flu, a cold, or actually COVID-19? The symptoms overall do seem very similar. The best judge is you. You know your body better than anyone, and more than likely, you've had the flu or a cold in the past. You will be better at identifying unusual or severe symptoms for yourself. That being said, in this current environment, any symptoms which could be suspected to be COVID-19 have to be taken seriously. Safety precautions should be taken the moment you feel sick, for your safety and the safety of all people around you. When should you seek medical attention? There is no 100% correct answer. There isn't just one symptom which will determine COVID-19, and a combination of symptoms is possible. You know your body best, and therefore you can judge the urgency often better than others. If you are not sure, please seek medical attention if you have the following symptoms: trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. Knowing how this virus spreads is very important, since this can help us reduce the spread. Knowing what to watch out for and what you can do can be an easy way to help keep yourself and others safe. The main way COVID-19 spreads is from person to person through respiratory droplets, which are produced when talking, sneezing, coughing, and even yawning. The virus travels from one person to another through the air, and many factors determine how far the virus can travel in the air. Not all people show symptoms. People who have COVID-19 yet don't show any common symptoms are considered asymptomatic. Being asymptomatic doesn't imply that you're safe to be around. If you are asymptomatic, you are just as contagious as someone showing symptoms. In addition to person, the virus can be spread through contact with contaminated surfaces and objects. Respiratory droplets can land and survive for a set amount of time on surfaces and items. Touching your eyes, mouth, or nose with unwashed hands after touching contaminated surfaces will increase your risk of illness. Be aware of high-touch surfaces in your surroundings, at home and at school. Grossmont Union High School District highly advises everyone to self-monitor at home for any COVID-19 related symptoms before coming to school. This includes taking your temperature if possible. Be aware of infected individuals around you and in your community. If you believe you may have COVID-19 or display symptoms, please stay home and contact your healthcare provider. Your school will have their own specific safety plans. Please read your school's plans and understand them. If you have any questions, please contact your school's administrative office. Understanding your school's procedures will help you to know how to act in a specific situation. If you start to have any of the COVID-19 related symptoms or feel sick during school hours, please immediately contact your school nurse or school administration. Isolate yourself from others, keep social distance, and wear a face covering. Every virus is dangerous in itself, but how dangerous a virus is can differ from person to person, depending on their situation and medical condition. There are certain individuals who are considered high risk for COVID-19. This does not mean that if you are not considered high risk, you are safe. This disease can be very dangerous for anyone. Currently, there is no vaccine for COVID-19. And the only way to protect ourselves and others is through non-medical approaches. Key practices to implement are social distancing, wearing a face mask that covers your nose and mouth, frequent hand washing and wash for at least 20 seconds, proper cough and sneeze etiquette, avoid touching your eyes, nose, and mouth. Stay home if you are sick. Besides social distancing, which isn't always possible, wearing face coverings is the most effective way to reduce the spread of the virus. There is a small population who are exempt from wearing face coverings, but there are still safety measures that such people can take. There are different types of face coverings, such as homemade coverings, surgical masks, or N95 respiratory protection masks. Please remember that face coverings are required to be worn at your school or school property, including buses. Terminology can be confusing in these times. Knowing the difference between cleaning, sanitizing, and disinfecting is important, especially when you talk to others. So how will Grossmont Union High School District protect you? As mentioned earlier, every school has COVID-19 safety plans. In addition, GUHSD will provide hand washing locations and hand sanitizer, physical distancing guidance, control of foot traffic, and physical barriers. GUHSD will encourage passive monitoring or self-monitoring. GUHSD will provide face coverings if needed, provide training, clean, sanitize, and/or disinfect areas as needed and/or required, have open communication with students and parents. If a teacher or student tests positive or is suspected to be positive with COVID-19, then GUHSD may require the entire cohort or class and possibly all close contact individuals to self-quarantine and follow the return to work or school guidance. For more information, please see the COVID-19 prevention plan for your school. Should there be a positive case in an area, the area will be immediately closed off. We will wait 24 hours if possible to minimize the exposure risk. If available, we will use a fan for additional air circulation. All windows and doors will be opened. The area will be cleaned and disinfected with EPA-approved material. In addition, all areas positive COVID individuals used or visited shall be cleaned and disinfected. If more than 7 days have passed since a positive case was in a particular area, this area does not need to be disinfected. What if someone tested positive for COVID-19? When can they return to school? GUHSD requires you, per CDC and CDPH guidelines, to have 3 full days with no fever and taking no medication, and at least 10 days have passed since the first symptoms, and symptoms have improved, and you must be cleared by GUHSD medical staff and site administration. A confirmed positive case with no symptoms can be around others after 10 days from the test date. As mentioned previously, each school has their own COVID-19 prevention plan. Please read your school's plan. If you have any further questions, please contact your site administration. Thank you, and be safe.